Hello, everybody. In this session, we are talking about glossophobia or fear of public speaking. Glossophobia or the fear of public speaking is one of the most common phobias. The good news is that there are ways to cope and learn to overcome your fear, such as using strategies to calm your nerves, practicing the presentation frequently, and engaging your audience with questions. Public speaking causes feelings of anxiety in 15% to 30% of the general population, and it can sometimes hinder a person's day-to-day life. This is especially true regarding school or work related situations involving speaking in front of others. Phobias categorized into one of three categories. The first, specific phobia, a fear related to a specific object like spiders or confined spaces, or a situation such as flying. Then the second, agoraphobia, fear of being in situations where escape might be difficult or that help wouldn't be available if things go wrong. This term is most often used to describe a fear of crowded spaces. And then the third, social phobia, a fear that involves a significant and persistent feeling of social anxiety or performance based anxiety. And then causes of glossophobia. Most phobias seem to appear out of the blue, often starting in childhood or early adulthood. A phobia may arise because of a combination of genetic tendencies and other environmental, biological, and psychological factors. People who fear public speaking may have a real fear of being embarrassed or rejected. Glossophobia may relate to one's prior experiences, or if a person is told to speak to a group on the spot with no chance for advanced preparation and it does not go well, she may begin to fear public speaking. And then, how can you overcome your fear of public speaking? Fear of public speaking is a common form of anxiety. It can range from feeling a little nervous to extreme fear and panic. You may try not to speak publicly, or you may do so with trembling hands and a shaky voice. But by preparing, practicing, and getting help if needed, you can overcome your fear. The first, know your topic. The better you understand what you're talking about, and the more you care about the topic, especially, the less likely you'll make a mistake or get off track. And if you do get lost, you'll be able to get back on track quickly. Take some time to think about up to 5 questions the audience may ask and have your answers ready. And then the second, get support. Join a group that offers support for people who have a hard time with public speaking. And then third, get organized. Ahead of time, carefully plan out the information you want to present. This includes any props and audio or visual aids. The more organized you are, the less nervous you'll be. Use an outline on a small card to stay on track. If possible, visit the place where you'll speak, review the equipment, and practice the talk before your actual presentation. And then fourth, celebrate your success. After your speech or presentation, give yourself a pat on the back. It may not have been perfect, but chances are you're far harder on yourself than your audience is. See if any of your specific worries come true. Everyone makes mistakes. Look at any mistakes you made as ways to make your skills better. And then fifth, practice, practice, and practice. Practice your presentation several times. Do it for some people you're comfortable with and ask for feedback. It also may help to practice with a few people who you don't know well. You may want to make a video if your presentation so you can watch it and see ways to improve. And then, who does glossophobia affect? Most people with a fear of public speaking are normal, intelligent, happy, and well balanced. They often come across to friends and colleagues as confident and outgoing. Many of the people can rise to a level in their career where they are more and more called upon to share their knowledge and expertise. And then, what are the symptoms of glossophobia? If you experience the fight or flight response from your glossophobia, your brain releases more steroids and adrenaline when meeting the perceived threat. Your blood sugar, blood pressure, heart rate, and energy will rise, which will increase blood flow to your muscle. Some of the physical symptoms of glossophobia include muscle strain, dry mouth, excessive sweating, hyperventilation, increased heart rate, nausea or vomiting, uncontrollable trembling, and dizziness. If you notice any of these symptoms before video meetings, presentations, or other public speaking events, then it's essential to address the condition. If ignored, your glossophobia could put you at a higher risk of developing depression or other mental health disorders. People with social phobias tend to avoid certain social situations, potentially leading to feelings of isolation, anxiety, and or depression. I think it's enough for this session. Thanks for watching, and don't forget give this channel with your like, comment, subscribe, and share. Thank you.